How do you feel about vaccine mandates? Do you think they're a legitimate public policy solution?
Well, we certainly know from a lot of the evidence that vaccines across a number of different disease areas have made an impact on public health.
David, can I ask you a couple questions on how AstraZeneca is planning for the disease X? Do you have any comments about the coming infection X that they're talking about here at World Economic Forum? Run away. How come you guys are running away, David?
We'll go over here. Get out of the street.
Okay. I got some questions about AstraZeneca. Yeah, I'd love to, and thank you for doing that.
Yeah, you're welcome.
Well, I want to ask you about AstraZeneca because you've been in the news a lot, and I want to say, first of all, what lessons do you think AstraZeneca has learned from COVID-19? Do you think you did anything wrong?
Well, I think that the biggest lessons that were learned is that public-private partnerships have really been brought to the fore as a way that progress can be made.
So you're saying the vaccine mandates, is that what you mean?
Oh no, I'm actually really talking more instead about the global effort that was made by the entire sector to be able to address the pandemic.
Well, that's one thing, and I have no problem with that, but what about the forcible nature that so many people were forced to take the jab or lose their job?
Oh, well, what I'd like to actually just say within this is that we're certainly proud of the efforts that collectively that the healthcare sector made.
Right, and I know that, and I'm not disputing that, but
I think that if you'd like to discuss any of this further, that you can certainly be in contact with our media relations group, and they'd be happy to get in touch with you on it, okay?
I don't think they would be happy to get in touch with me because they, just like you're not answering.
That I do
well, let's walk into. I'm walking with you. I'm not slowing you down.
All right.
How do you feel about vaccine mandates? Do you think they're a legitimate public policy solution?
Well, we certainly know from a lot of the evidence that vaccines across a number of different disease areas have made an impact on public health.
And I'm not disputing that. I'm asking you about the forcible nature, that if they weren't forced to take your medicine against their will, they'd be fired.
I need to go on this, but what I would say is that all of this comes down to local decisions that are made by countries.
Local decisions? I think you profited by it. There you have it, AstraZeneca. They ran away from us at first, and then he decided he was going to give banal answers as he walked a block. I'm not impressed with it, but I mean, what are you going to say? He's a vaccine salesman. The pandemic was the best thing that ever happened to his company. No wonder that one of the agenda items here at the World Economic Forum is disease X, infection X. They haven't named it yet. It hasn't presented itself yet, but boy, their vaccine salesmen are salivating. For all our reports from here at Davos, go to wefreports.com. I'm here in Davos, Switzerland with a team of 6 journalists from Rebel News. You may remember last year we managed to scrum the CEO of Pfizer and Greta Thunberg and other people who want to control your life. We might even bump into the chief of BlackRock, Larry Fink. If you think our journalism is interesting and important, please go to wefreports.com. All our videos will be there. And if you can, please chip in a few bucks to crowdfund our economy class airfare to get here.